Welcome to MIPS Tips for Eligible Clinicians with the QPP News Team. Today, we're bringing you tip number 6 from the top 10 tip list. Simple steps to set quality goals and timelines.
So in tip number 5, we encourage healthcare clinicians to review and understand their current performance scores. Now that you are analyzing your data, it's time to use that data to set goals for success. For most organizations, getting started can be the hardest part.
That's why we recommend that you start by assessing your organization's quality improvement or QI culture. If your organization doesn't already support a culture of quality, it's time to establish a QI culture.
So how do you know if your practice has a QI culture?
Now this can look different for every practice, but questions you can ask include, do we have established dedicated QI teams? Are we holding regular QI meetings or including QI on our regular meeting agenda? Have we created policies around quality improvement goals? Practices that have achieved patient-centered medical home recognition are a perfect example of an active QI culture. The principles behind PCMH standards drive this.
So are you recommending setting a priority to create a QI team?
Yes, I am, and that team will be unique to your organization depending on the practice size and the scope of work. It may include everyone in the office to just 2 to 3 people. And then after empowering this team to serve as QI champions, use the quality data from the QRUR, EHR reports, and any external data reports you may have to set clear, measurable goals for what can be done to improve the existing conditions.
And before setting the goals, you may want to consider the following. What areas or measures in your practice can benefit most from change? What improvements will most affect patient outcomes and satisfaction? After all, this is all about the patients. And what groups of clinicians and staff should we involve in each item? Have some fun with goal setting. Involve everyone in the office by asking for creative suggestions on ways to eliminate inefficiency. You might be surprised at the ideas you get.
So I think next up should be implementation plan and a timeline?
Well, somewhat, yes. Be sure the goals are clearly defined as quality goals, and for each goal, define a plan of action for achieving it. What specific steps do you need to reach that goal, and what data do we need to collect? How will you implement these steps?
And then develop a timeline?
Soon, Dr. Paul, soon. Measuring success is very important. Determine how you will measure the success of your action plan, and keep it simple. Don't get too hung up on statistics, sample sizes, and other complicating factors. However, do use any baseline data that you might have, so you'll have something to compare your quality improvement efforts to.
And now develop a timeline?
Yes, develop a timeline to keep you on task. Then start your data collection. Data collection and analysis lie at the heart of your quality improvement. Your data will help you understand how well your systems work, identify potential areas for improvement, set measurable goals, and monitor the effectiveness of change. And to reiterate what Susan said previously, it's important to collect the baseline data before you begin a QI project, so you know your current status. You'll also want to commit to regular data collection and carefully analyze your results at the end of the project and make decisions based on your analysis.
And if you don't meet your measurement for success the first time, reevaluate and keep trying. Quality improvement is a never-ending task.
It's important to communicate your results. Your QI efforts will affect your staff members and your patients. As you plan and implement a QI project, communicate your project needs, priorities, actions, and results to the entire practice. When a project is successful, celebrate and acknowledge that success.
Commit to ongoing evaluation. Quality improvement is an ongoing process. A high-functioning practice will strive to continually improve performance, revisit the effectiveness of the interventions, and regularly solicit patient and staff feedback.
Well, QPP News team and viewers, I'm afraid our time together is running out. Before we close, I'd like to ask Susan for a quick recap of MIPS tips number 6, simple steps to set quality goals and timelines. Bring it all together by tying it to MIPS reporting of quality measures.
Of course, I'd be happy to. The proposed rule for MACRA brings a whole new methodology for promoting appropriate health IT use and quality reporting as part of MIPS. Eligible clinicians will be scored by the quality measures they report, which in turn determines the financial impact on their Medicare fee-for-service reimbursement. By following these steps, a clinician can improve their outcomes and their patients' well-being. Number 1, establish a quality improvement culture. Number 2, define clear goals. Number 3, develop a plan of action, including implementation and timeline. Number 4, collect and analyze your data. Number 5, communicate your results, and don't forget to celebrate successes. And number 6, commit to ongoing evaluation.
Great information again. And that concludes today's segment. Thank you for watching the QPP News Team with Sandy, Susan, and Dr. Paul. Join us for MIPS Tips number 7. We're going on the road interviewing a QA advisor who works directly in the field helping clinicians set goals and improve their PQRS and quality measure performance.